I want to believe everyone can hear me clearly. Today is a World Cancer Day. This is 4th of February. Every 4th of February is World Cancer Day. And there are different reasons for that. Of course, conventionally, it is to create awareness on different types of cancers and so on and so forth, and what has been done or is being done to reduce the menace of cancer. But for us, for me, it's not just about celebrating or creating awareness about cancer. I doubt if there's anybody who does not know what cancer is. I mean, conventionally speaking, but there's more to it. It's also a day that we said, let's give people hope and let people know that cancer is not a death sentence. Because in whatever it is people are doing, when there is no hope, then, like they say, death is round the corner. There's a popular saying that one can go without food for 40 days, can go without water for 3 days, but without hope, it's just a question of minutes. Though the person may be alive, but literally the person is dead once there's no hope. So part of what we're doing today is disseminate hope, give hope to those situations that look as if, oh, there's no hope, to let people know that if you have an understanding of what cancer is, then you begin to realize that the way it's being handled by conventional wisdom does not make sense. The theme for this year's Cancer World Cancer Day is Close the Care Gap. And we're going to be looking at the various ways this gap between various cancer cares can be closed. Okay. Now, the first thing we want to look at is this: closing the gap in cellular communication. For instance, what most people do not know is that most cancers begin as a result of breakdown in cellular communication. So today, that the theme for this World Cancer Day is closing the care gap. We're not just looking at care alone. We're also looking at how do we close that gap that makes people develop cancer. Like I said, the breakdown in cellular communication is one of the root causes why people begin to even develop cancer in the first place. But what a lot of us do not know, nobody just wakes up and develops cancer. Before anybody can come down or come up with that diagnosis called cancer, it must have gone through what we call 7 stages, which a lot of times goes unnoticed. Cancer doesn't just wake up and develop, no. It must have been in the body for like 10 years, in some cases 15 years, building up, battling this thing we call breakdown in cellular communication. And part of what I want us to leave tonight's meeting with is, how do I ensure I deal with this breakdown in cellular communication? Of course, you may not have the privilege of looking inside your body always to know what is going on there. But when you have an understanding that, oh, some of these signs I'm seeing, maybe certain types of headaches, certain types of body pain, is actually one of the ways your body is telling you there is a breakdown in cellular communication in the body, then you will now know what to do. Because the reality is this, you can prevent any of this around with malignant cells. There's nobody that doesn't have the so-called cancer cells, abnormal cells in the body. But not everybody will develop cancer. And like the Bible says, my people are destroyed for lack of knowledge. Part of what we're doing is pass on this knowledge so that you will know that some of the things we are shutting down with prescription drugs are actually ways your body is giving you an alarm that there could be a problem. So we want to close that gap, not just the care gap. Then, of course, the other gap we want to close is to close the gap between conventional medicine and natural medicine. Because we have found out that in conventional medicine, They have told us that there is no cure for cancer. That's fine. But in natural medicine, people are recovering from cancer. So how do we close the gap between conventional medicine and natural medicine, what we call integrative medicine, so that people can get good results when they have cancer? Because the reality is that, yes, people are recovering from all these diseases they said, oh, it's incurable. People are reversing diabetics, people are reversing high blood pressure, people are reversing all manner of chronic diseases. So how do we close that gap so that in conventional medicine, some doctors see it as a threat. They see natural medicine practitioners as a competition, like anathema. You don't even want to talk about it. You don't want to discuss nutrition. You don't want to discuss, encouraging your patients to change their lifestyle. This morning, and she told me that her doctor in one of the hospitals says she can eat anything. How? How do you tell a cancer patient to eat anything? Now, anybody that tells you to eat anything, that person is telling you, make you just enjoy your life because you go soon. So it is not a good advice. You can't tell a cancer patient, when we all know, even a small baby knows that you are what you eat. So if you see yourself in a situation where anybody tells you, no, don't worry, continue with your treatment, and you're doing chemotherapy, you're doing radiation, and your oncologist is telling you you can eat anything, please, let me tell you what that message means. What that message means that everything they're doing for you is palliative. They know it's a question of time before the person goes. So you must take your health destiny in your hands. Do your research. Know what you ought to eat and what you are not supposed to eat. And where you need help, seek help. Seek help of a holistic nutritionist who understands what to feed the body to stop the growth of cancer cells. So that is part of the gap we need to bridge. We need to bridge that gap between conventional thinking, conventional medicine, and natural medicine. The whole idea is this: so that those who have been diagnosed with cancer, they will be able to find hope and know that, yes, I'm receiving the best care. In some civilized societies, in places like China, in places like India for now, Mexico, and a whole lot of other places, when you come into the hospital, some of their hospitals, you are given an option. When you come into their hospitals, you are given an option of whether you want integrative care or whether you want to do purely conventional treatment. For example, in cancer, purely conventional treatment means that you want to do the surgery, you want to do the chemotherapy, you want to do the radiation, and so on and so forth. But in hybrid care, they also ask you, do you want a hybrid? Do you want hybrid option? Those people that go for hybrid option are those who, yes, they may want to do chemotherapy and all that, but they first of all boost their immune system with a lot of natural nutrients, nutrition and supplementation. They first of all boost their immune system. And why is that important? For the fact that someone already has a cancer diagnosis means that the immune system is very low. Now, if the person goes on straight into doing some of these invasive procedures, like certain biopsies that are very invasive, then you now move on to surgery and you move on to chemotherapy and radiation without boosting your immune system, then the person is asking for trouble. Because the reality is this: in every sickness, you need a strong immune system to fight. But however, these treatment routes, surgery, chemo, radiation, they destroy the immune system the person needs to fight. So there's nothing wrong if you decide to go through those routes of treatment. But what we're saying is, you need to be able to find a holistic practitioner that will advise you. And if your oncologist say, I know that the supplementations, the supplements and all that, they affect the efficacy of the chemotherapy drugs, please, that is a very big lie. Because so many clinical trials, so many research has been done, and we found out that it's not true. A lot of doctors, clinic oncologists are no longer studying. They are backward. They are not up to date with current realities in cancer treatment. So many of them are stuck with this conventional thing of surgery, chemo, radiation. And that is what is killing people. So if you find yourself in that situation, please, you have a right. There's what we call Patient's Bill of Rights. You have a right to demand, because I don't think anybody is going to have a problem with you saying, I want to, first of all, build my immune system before embarking on any treatment. And I'm going to tell you something. No cancer is an emergency. None. Except where there is a tumor present on the blood vessel, or tumor present on the pancreas, or tumor present on a part of the brain, making it impossible for blood to flow. So if you go to a hospital and, I mean, like you saw a lump in your breast and you had to go do some tests and all that, and maybe 2 weeks or later, the result comes out after the histology results, and they said the lump is malignant. Please do not allow anybody pressure you into any quick to seek opinions. And of course, what you should do when you have such a diagnosis, seeking opinion doesn't mean you should fold your hands while you're seeking opinions. No. While you are seeking opinions, please start the do within your own house, within the confines of where you are. Things like boosting your immune system, changing your diet, which is very, very critical, while you are deciding what to do. Because the reality is that the moment they have put, depending on type of biopsy you did, if, for example, you did pin biopsy or true cuts and all that, you don't have that luxury of time, because that cutting that has been done already has enabled some of the cancer cells to escape. So if you keep quiet, you're worsening the situation. That cancer, you hadn't touched it. So when you go to hospital and they do a biopsy and they said, oh, the cells are malignant and all that, please do not panic. That is part of the message we are communicating. I'm going to take a 2-minute break right now so I can change systems, because I'm just coming out of the airport. Please hold on. Okay, so sorry about that. I'm on the road and doing this. So, like I said, there's no rush. Don't let anybody rush you into going in for any quick surgery, mastectomy. Mastectomy is a very, very invasive procedure. Before you go into all that, please ensure that your immune system, you have done something to boost your immune system. You have done something to ensure that your body can withstand further treatment. hear me now?
Yes, we can hear you now, ma'am.
Can you hear me now, please?
Yes, we can hear.
You can just put in the chat. Let me be sure. Okay. Okay, thank you. Okay. Sorry, I didn't know. On mute. Okay. So basically, like I said, before any cancer diagnosis can be made, it has passed through what we call the 7 stages of disease progression. And it's important that you understand it so that when the body begins to give sign, you will know, this headache is not just ordinary headache. Then you know what to do. Now, the first stage, which a lot of people are already going through, but they may not know, is called innervation. Now, because of the society we live in, the system we live in, it's very possible for your body to be battling with innervation without you knowing. What is innervation? Innervation is a condition in which the body, that's the human body, is not generating sufficient energy for the tasks it must perform. It is also the condition in which the tasks the body must perform are greater than the normal energy supply can cope with. So under innervation, elimination and excretion of waste products fall far short of requirements, leading to the building up of toxins. Now, these toxins that keep building up, they keep building up over time without the body being able to eliminate it, is what now begins to create further problems. Because the reality is this: even if you eat all the good food, you drink all the good water, certain things are out of your control. The air you breathe is out of your control. And like we have been told that we inhale over 500 chemicals on a daily basis. So when you inhale these chemicals and you are not able to take them out, they keep accumulating. Part of what we're going to look at shortly is, okay, how do I ensure that the toxins that come into the body, that they are eliminated? Because you can actually ensure, of course, you cannot eliminate everything 100%, but you can do certain things to ensure that these toxins leave your body, that they don't keep accumulating. So a lot of people are on that stage 1 of innervation without knowing it, where the body is not able to take out waste products. Of course, they go to toilet, they urinate and all that, but that's not enough. Because of the system of polluted environment that we live in, one must be intentional in ensuring that, yes, you take out as much as possible. That's why I encourage people, as long as you eat 3 times a day, some people eat 4 times a day, the minimum number of times you should go to toilet, at least 2 or 3 times, if your system is functioning the way that it should. But what do you have? You have situations where people don't even go to toilets for like 3 days, 4 days, and they are eating. And if you do that, you notice that if you may be having some headache, and the person will not know that that headache is part of the way your body is telling you that you are carrying dustbin inside your colon. And what would the person do? The person is part of the ways your body is telling you that your body is dirty, that you need to clean up. You know, this thing is also like the same way you know that you need to take a bath regularly, take a bath externally. The same way you also need to take a bath internally, wash your inside, you know, that's the inside of your body, clean up. And there are things you need to do to be able to do that, okay, regularly, as much as you can. Then after that first stage of innervation, you move to the second stage, which is toxemia. Now, this toxemia occurs when uneliminated waste products from the trillions of metabolic processes, they start to saturate the circulatory systems of the body. At this point, the person begins to feel more tired regularly. You wake up still feeling tired. Some people feel very sluggish. Sometimes you might even have a little fever and all that. And what do? Of course, we suppress it with antipyretic drugs. We say, I'm having this headache, I'm having this. So you wake up in the morning after sleeping for how many hours? You're still feeling very sluggish. No. something is, cancer does not just come up. No, it's not a sudden anything. It's not a sudden disease. It's not a sudden sickness. I toxemia. So at this point, the body sets its defensive mechanism into motion because a whole lot of toxins are beginning to appear, tickling of the nose, uneasiness, depression, worry, headaches, minor aches and pains, insomnia, and all that. But of course, at this point, what we shall also do in majority of the cases, because people do not know, they shut down these signs with prescription drugs. When this continues, you now move to the main one called inflammation. And inflammation is the one that most people are battling with, because at this point of inflammation, the body is now using every effort to clean itself and restore itself. Inflammation is the body's urgent. A woman, for instance, who sees a tiny lump, because there's no lump that wakes up one day and grows into a big lump. No, most lumps start as a tiny, something very tiny. Okay. If, for instance, you see a tiny lump in the breast, do not panic. Yes, of course, everybody, when they hear the word cancer, they are afraid and so on and so forth. There's nothing wrong. First of all, the first thing to do, shut down all the nonsense that goes into your mouth. That's the number one thing. Shut it, cut it off, because we know when we're eating a lot of junk food, we know when we're eating rubbish. So you cut it down first, because the reality is that something led to that situation. Now you begin what we call cellular nutrition. You must understand what we call cellular nutrition. What is that? Cellular nutrition is that situation where you, and what are those foods? Whether you like it or not, when there is a problem, when there is a health problem, it is time to remove certain foods from your diet. What are those foods? Number one, meat. All associated products, you take it out of your diet. Remember this time, you are still looking at that small lump. You have not gone to go and start touching it and so on and so forth. What are you doing? You're trying to, first of all, let me even build up my immune system. There's nothing wrong with going to check what that lump is. We call it spying the land. Now, when you go to check that lump, you must be very, very informed so that you can have a discussion with your doctor. One of the things we always advise people to do is this. It's better they just take out that lump. They should carry it and take it to the lab for histology and all the rest of them. Do not allow anybody experiment and do experiments inside your breast. What do I mean? In some cases, you see them, they open up the breast, they collect a sample of that lump and leave the remaining in there. If you allow anybody do that to you, you're putting yourself at greater risk. Insist. If you go to a particular doctor and you say, please take out this lump, they went to run, they did lumpectomy, and you ask, where's the result of the lump? They're not sure what they did with it. Oh, I don't understand. It doesn't make sense. So they should take out that lump and send it to the lab. But do not allow anybody open up your breast and take a portion of the lump. So when they have done that, come back and continue what you're doing. If depending on where you are, that is the time to start your vitamins. You start some of them you can take as infusions, some of them you can take orally. But if you can have them as infusions, excellent. Now, going forward, there are key nutrients. I keep telling everybody, please make sure you have these things around you. Because remember, part of what we're talking about today is prevention. Prevention. Because after that duration, and the body is no longer able to withstand all the inflammation and all the toxins, that's when the person can go to hospital and begin to hear all these diseases of cancer, cancer of this, cancer of that, cancer of that. No cancer happens suddenly. Please, let's have that at the back of our minds. And no cancer is a death sentence. In terms of prevention, there are certain nutrients you cannot joke with. I don't manufacture these things, so I'm not campaigning for anybody. Nutrients like glutathione, for instance, let me even start with that. Glutathione is one of the nutrients that prevents what we call oxidative stress. Yes, you can get it from food, but because of the way our foods are being grown, you can. Now, in these supplements, the dosages, those RDA dosages are just there for regulatory purposes. For instance, the amount of vitamin C your body needs that will make sense to the body. No. At least minimum 1,000 grams to 2,000 grams, 1,000 milligrams to 2,000 milligrams daily. What I advise people to do is this. There are certain multivitamin minerals that you can buy, and at least start with them. There are so many of them. And when you want to buy, please read the label. Look at the label. Buy the ones without iron. Why do you need to buy the ones without iron? If you're already at this point where your body is already at the level of induration and you're working towards cancer, which you may not know, swallowing multivitamins with ions will further empower the cancer cells. They make them stronger. So you need to be intentional about these things. When you go to buy, please read the labels. You can even Google them. Multivitamins, some pharmaceutical companies, they know this. So they produce multivitamin, multiminerals without iron. So if you're going to get one of them, like Vitamin Code and so many of them out there, take the ones without iron. There's Vitamin Code for men, there's for women. There are a whole lot of, there's a whole lot of them. And they contain all these vitamin E, vitamin C, glutathione, lipoic acid, CoQ10, and a host of others. So I advise you get this thing. But if you have the resources, get more of them. Get them like the glutathione, get the lipoic acid, get the CoQ10, get the vitamin E. And the best form of vitamin E to use is the powder in capsule. I'm not talking of this gel. The powder in capsule, it can either be a loose powder or, as much as possible, where you're taking these things, please try to empty the contents into water. Take it with a lot of water or your juice, vegetable or fruit juice or whatever, okay? Don't swallow a whole lot of those capsules, as much as possible. Okay, yes, I will write it out on the charts as I round up. Okay, so these are some of the things you need to get, because like I said, these things, there is no disease that cannot be prevented. We have found out, some people will tell you, cancer runs in the family. Research shows that cancers that are due to genetics is just about 0.5%. That's majority of cancer, over 98% is, over 95% is as a result of lifestyle. And anything that is called lifestyle, that is based on lifestyle, means that to treat it, to reverse it, you have to come back to lifestyle, change of lifestyle. So if you have any such situation of chronic disease and somebody is telling you, eat whatever you like, that person is just telling you that, indirectly saying that the person's time is short, so eat everything, enjoy yourself while you still have time here. That's not a good person to work with. So once you have any of this, please, of course, we don't overlook the place of prayer. I tell people something, the Bible tells us that no weapon that is formed against us shall prosper. But you see, a lot of times, why are those weapons prospering? Because we have broken the hedge of protection God has made around us. It is not the will of God for anybody to be sick and to die in sickness. He says, I wish above all things that you prosper and be in health, even as your soul prospers. So how do we break this hedge of protection around us? By the lifestyle that we live. And this lifestyle includes the kind of food we eat, the kind of exercises. And I want to also talk a little bit more about, a little bit on exercise. There's nothing wrong with exercise. You can look for what works for you. However, you must also understand that when you exercise, if you embark on intensive exercises, your body releases what we call free radicals. Now, if your antioxidant level in the body is so low, that it cannot mop up the excess free radicals, you are building up a case for cancer to come in. So you must understand that. So if you exercise, which is okay, make sure all these things I have said tonight, bottom line is that you need to make sure that you have enough storage of antioxidants in your body. And anybody can do this. Everybody can do this. We live in a very stressful environment. Very stressful. Because if I look at me personally, the amount of stress I've been through since Monday last week, I mean, it's enough to, cause an uproar of free radicals in the body. Because throughout Monday last week, I've like literally lived up there in the air, you know. But one needs to be intentional about these things. Build up your antioxidant levels. These supplements I have mentioned, make sure you have them as your friend. You are being intentional. And of course, there's also what we call the spring cleaning. Take out 2 days in a week that you don't eat any cooked food. Why do I say that? The amount of energy the body uses in digesting cooked food is a lot. So when you want to detoxify, remove cooked food. Allow the body to use that energy to go and pull out all the toxins that is hiding in different places in the body. Pull them out. And you find out that when you do this, sometimes at the end of the 2 or 3 days, you might even start feeling feverish because there's war, in quotes, going on in your body. Your body is pulling out those toxins that will go and hide in there and be looking for who to cause trouble for. Not yes, of course, anything that is not of God is demonic. But you can still make it not happen. It doesn't matter. They say, oh, it's fear. Once they say, oh, this thing runs in the family, the person is already afraid. Fear has torment. And if you know what fear does to your immune system, then you do everything within your power. Because when you have knowledge and you have information, you can deal with fear. If you have not, but if you don't have information and you think, oh, cancer, hey, how cancer, they said, oh, it can kill, oh, it is doing this one, or it is doing that one, oh, then fear has torment. Satan will have a loophole. Job said in the Bible that the things he feared most came upon him. The fear of cancer is killing more people than the cancer itself. So I want to encourage us tonight, on this day of creating awareness on what cancer is, that cancer is not a death sentence, that you can actually prevent cancer. And that if you have it already, you can actually reverse it. But that reversing depends on the steps you have taken towards getting a treatment. If you take the experiments, like I tell people who is thinking that that's where the solution is, I have good news for you. That's not where the solution is, because a lot of them will end up using you, a Black person, as experiments, use you for clinical trials. And by when I was coming back, I saw a woman. I know they have told her to go home and die. It broke my heart. And I was talking with the daughter. I said, is that your mom? She said, yes. I said, is she okay? She said, no. She had cancer and they flew her to the US, to the best hospitals, of course, they pumped her with chemotherapy, radiation, and all the rest of them. And they got to a point, they told them, I'm sorry, we are sorry. Her body can no longer accept the treatment. So they said, okay, it's better to bring her home so that she doesn't die there in the US. I mean, you could see the woman, she couldn't, of course, they had to use pillow and all manner of things to prop her on the wheelchair. I felt so bad. And I said to myself, this woman obviously used her 2 legs to enter plane to go for this treatment. She went in search of cure. But those cures are not what they seem. So before you start jumping out of the country, thinking you're going to get the best cancer treatment, think twice. Think twice, because in those systems, some of the things we take, you can walk into a shop, buy vitamin C infusion and all that. Yeah, they know, you go write prescription tire before you can get any of those things there. So I tell a lot of my patients out there, you better come back home. You better come back home, because here there's a whole lot of things you can access. And the reality is this: we are truly blessed. As a people, we are truly blessed. The only thing I try to take out of people's minds When they tell you here because it is cheaper, forget it. Anybody telling you that is telling a lie. So that's why we keep pushing prevention. Some of the things I'm sharing here, if you go to some places, they will charge you money before they can even give you some of these prescriptions. So please, let's take them, get them from different good pharmaceutical shops. If you're on the health platform, the one you need more information, please feel free to ask. We will be glad to give this information. If we can have as many people as possible get out of cancer, be cancer-free, because the reality is this: if you are healthy, you are better able to fulfill God's purpose for your life. For me, that's the goal, to see as many people as possible fulfill God's purpose for their lives in a healthy body. Cancer is not what you want to joke with. It is nobody's friend. But at the same time, there's hope. You can overcome it, you can prevent it. But you need information, you need knowledge. I want to thank you all for joining, and God bless you all. Do you have questions or comments? We'll be glad to, while I type out the things I mentioned on the chat. To be eating all the grains. I'm talking of millets, acha, those local ones, guinea corn. What are they? Then of course, if you are abroad and if you have the money for all that, you can add all these quinoa. You can add all the what are they? There are so many of them. Okay, those are whole grains. Of course, don't overlook your beans. Now, beans, I tell people, is one of the foods you cannot afford not to keep in your house. And to cook your beans, please, we always advise people to get the most out of your beans. Please soak it for nothing less than 7 hours. If you can soak it overnight, that would be excellent. When you soak your beans overnight, the enzymes responsible for germination, they begin to sprout. If you see some people, they complain that when they eat beans, it gives them heartburn, it gives them so and so. When you prepare your beans this way, you can never have heartburn. So when you soak it overnight, the next morning, pour out the water, then cook your beans the way you normally cook it. Now, you can make it in 2 ways. Make one white, then keep the other half for your orishi beans that you add your oil and all the bobo that we put. That one that you made as white, you can eat it with your steamed vegetables, you can eat it with different things. Remember, the intention is not to eat and enjoy, but also to give your body what it needs to address things inside your body that you don't want them to start coming out before you now address them. There's a whole lot happening inside that body that is better for you to just give your body the support, the arsenal it needs to fight those things. So you can intentionally make your food 70% of this healthy eating, then 30% of orishi, so that those who go to Owambe every Saturday, every Friday, you can keep the 30% to be eating all those orishi. Like we just came from Akwa Ibom, where we were hosted to a sumptuous meal of afang, edikaikong, epang, afiefere. But the reality is, how much can you eat? I enjoyed all the afang, I enjoyed all the epang. In fact, I had to carry my own back home. You know what I mean? All that fall under the 30%. So you can also have your own what's it called? 30%, 70%, but be intentional. That's the whole idea. Then you, of course, you take out like a day or 2 in the week where you remove cooked food, anything that is cooked. Just feed your body. Stay in your house. You don't need to go too far. Feed your body with fruits, vegetables, and all that. And I tell you, over time, your body will begin to say thank you. Okay. No, okay, somebody says some time back, we heard it's not good to break capsules open to take its consent. No. Now, see what we normally tell people. If you're taking prescription drugs, you know those prescriptions like antibiotics and all that, of course, you're taking them for like 5 days now, 7 days max. Okay? You can swallow them like that. Because me, I don't even like the taste. You can swallow them like that. But I'm saying where you now need to take supplements, like all that I have listed, because these supplements, you're not taking them for 2 days. You're going to take them for a while. What I now advise people to do is, if you take for like 3 months, you take a break. Okay. Then, of course, try as much as possible to be changing the brands so that your body will not develop resistance. Remember, you're breathing every day. You take in air every day. You're taking toxins every day. So this battle is a continuous battle. But as much as possible, because I've had people, they say